protect.
Federal health officials are on Capitol Hill today defending the country's response to the Ebola crisis. Now that 2 nurses at a Dallas hospital got infected while caring for a Liberian man who died of the disease.
Errors in judgment have been made, to be sure, and it is our immediate responsibility today to learn from those errors, correct them rapidly, and move forward effectively as one team, one fight.
2 big questions. Why was one of the nurses, Amber Vincent, cleared by the Centers for Disease Control and Prevention to fly home from a trip to Cleveland with a low-grade fever?
My understanding is that she reported no symptoms to us.
And are the country's hospitals truly prepared to care for Ebola patients? The CDC said Thursday it's working to better educate healthcare workers.
There are more than 5,000 hospitals in this country. We're there to support, we're there with world-class expertise, and we're there to respond to threats.
Officials are trying to calm any fear, notifying Vincent's fellow air travelers. In Texas, one school district temporarily closed 3 campuses after it learned 2 students had been on the flight. The passengers are considered at low risk for Ebola. It's spread through direct contact with bodily fluids when a patient is symptomatic. Local health leaders in the Cleveland area are now retracing Vincent's steps during her recent visit there with family.
She was not at football games, she was not at restaurants, she was not at a pizza parlor, she was not at the grocery store. She was in her home. She's a very conscientious young lady.
Vincent is now being treated at Atlanta's Emory University. The other nurse, Nina Pham, will be moved to a special isolation unit at the National Institutes of Health in Maryland. Elsewhere, international airports in Chicago, Atlanta, Newark, and D.C. start screening passengers today from the 3 most affected West African countries, Liberia, Guinea, and Sierra Leone. Cindy Sharp, Associated Press.